Good morning, everyone. My name is Matt Hansen. I'm a associate managing director with Widow O'Brien's, and I'm supporting the Office of the Recovery here in the state of Kansas. And I want to welcome everybody and appreciate your time this morning. We, as you know, have had a series of webinars with you about the American Rescue Plan, and in particular, the state and local fiscal recovery funds. Our previous webinars were at a very high level, the 30,000 foot view. This webinar is intended to be a little more granular, but still we're talking about 151 pages of guidance from Treasury, so we will not be able to get into too much detail, but over the coming weeks and months, we'll continue to do deeper dives into the Treasury guidance and try and be as supportive as possible as you all look to apply for, receive, and implement your funding. Next slide. So just a really quick agenda and the objectives of today's meeting. So again, a deeper review of the background on the state and local fiscal recovery fund. We have a mixed audience today. We have folks from state agencies, but we also have county and local government folks as well on today's call. We'll do a deeper dive into the eligible or allowable use categories, and then review some of the federal compliance and oversight requirements and talk about next steps. Next slide. So you've seen this slide previously. We always want to include it as a point of reference as we continue these conversations. The takeaway is there's a significant amount of funding coming into the state of Kansas. Unlike the CARES Act and the Coronavirus Relief Fund, there's not a natural flow from the federal government through the state of Kansas to local governments. In this instance, the state is receiving about $1.6 billion in state fiscal recovery funds, as well as an additional $143 million in capital projects funds. The 105 counties, 10 major metros are receiving allocations directly from Treasury. And then the non-entitlement units will be receiving funding dispersed through the state of Kansas. But once that disbursement takes place, those units of local government will also have direct relationships with Treasury. In addition to the state and local fiscal recovery funds, there's also a lot of very program-specific funding coming in directly to state agencies, much of which will be passed through and make it to your local communities as well. Just to also remind everybody that Treasury has set up a tranche system. So 50% of the funding will be received in this year and 50% 12 months from now. Just a really important reminder to everybody as they're putting together expenditure plans and trying to do program design is to factor in that 50% allocation of funding. Next slide. So we just wanted to provide a high-level timeline. The American Rescue Plan became law March 11th. The covered period for the American Rescue Plan actually begins at the beginning of March. So as you're looking at expenses, you can go back and cover expenses back to March, even though you might not be receiving the funding until now. You will have until December 31st of 2024 to obligate. Again, an obligation essentially means having under contract or a commitment to spend the money. It does not actually have to be expended or liquidated by December 31st of 2024. Under this program, you actually have until December 31st, 2026 to complete programs, expend funding, and liquidate any final transactions. That is all assuming that the obligation did in fact occur before December 31st, 2024. So a much longer timeline horizon with these funds than we had with CRF, and should help with your program design, in particular infrastructure projects. Treasury has also been very busy in issuing guidance. We've talked previously about the interim final rule being issued on May 10th. There were a series of documents issued that same day. Since then, there have been minor releases or updates to frequently asked question documents. The most recent being June 8th. There's actually a June 10th that had some very minor revisions having to do with tribal entities. And please remember that we are still operating under the interim final rule. You do have until July 10th to ask questions and make comments to Treasury. So please take advantage of that. Next slide. So before I begin the discussion about allowable uses, I thought it's important for jurisdictions and organizations to understand the concept of risk tolerance. As direct recipients now with this funding, jurisdictions will have to decide who ultimately determines allowable uses. So you're not receiving pass-through funding from the state like many of you did with CRF. You will now have direct relationships with Treasury. So you'll have to determine internally whether legal counsel, finance staff, grants management resources, an outside audit firm, or other consulting support will make those allowability decisions for you. There's no right or wrong answer, just something you'll have to think about when you're identifying internal resources for the administration of these funds. For state agencies, this will be pretty straightforward, as will be the Office of the Recovery and the SPARC committee determining allowable uses. Some jurisdictions will be incredibly risk averse. And if the interim final rule or other Treasury guidance doesn't state it specifically, it'll be not allowable. Others will have a more liberal interpretation of the guidance and allowability provisions. Again, no right or wrong answer, just an internal discussion you need to have. As a jumping off point, the interim final rule and the FAQ state that many of the activities allowable CARES Act CRF remain eligible under ARPA, State and Local Fiscal Recovery Fund. So for many of you, this might be a convenient start or safe harbor to operate in, because you do have this precedent that was set under CRF. Many entities are also very good prospects of having to pay back money. While the normal process for Treasury to issue a finding and a question cost, then allowing the entity to do that finding or move funding from the question and cost to another allowable activity. Normally, as long as good faith efforts are made to implement internal rules and compliance requirements, the federal government will usually work with you to actually pay back funding. The things I'm giving you is absolute, but I just want you to know, based on 27 years of grants management experience, the federal government doesn't want you to pay back the money. So they usually work with you, give you a lot of opportunity to modify the or to move the expense off and use the money for another allowable purpose. Moving on, there are 4 eligible use categories. You see them on the slide. Built-in categories of eligible uses is a wide amount of discretion for your jurisdiction to determine the best use of the funding. When considering these eligible use categories, you should think of them as silos or swim lanes, or at least think about them. Are the allowability considerations going to be related to one of the general categories, nexus to COVID, premium pay, or one of the more specific categories like qualified census tracts or rent placement and the provision of government? Talk about these different categories on future slides. Each has pros and cons, but opportunities for additional allowable activities. So something might be allowable because it no longer has a nexus to COVID, but it could be allowable because it's occurring in a qualified census tract, or it could be allowable because it's the provision of government services through revenue replacement. It should be also noted that there are two explicit ineligible use categories. Other items that have subsequently been listed as ineligible. We'll talk about those on a future slide. And with that, next slide. The first eligible use responding to public health emergency economic impacts. There's a lot packed into this slide, and I'm going to rattle through this pretty quickly just to show you how much flexibility there is from a programmatic perspective. This is the allowable use category that's most closely related to the pandemic and to the prior program, the CARES Act CRF. But there is a lot in here in both the addressing the public health emergency, but the subsequent negative economic impacts that have occurred. To begin with, under responding to the public health emergency, the interim final rule directs ARPA funding to meet and address emergent public health needs, including measures to counter the spread of COVID-19 through the provision of care for those impacted by the virus and through that address disparities that have been exacerbated by the pandemic. There have been potentials of funding for the umbrella to the public health emergency include prevent and mitigate COVID-19. This is a broad range of services and programming focused on prevention and responding to COVID. I don't want to read through everything. It's listed in the final rule, but examples are vaccination programs, isolation, quarantine, paid sick and paid family medical leave, public health surveillance, enforcing public health orders, on and on, including purchasing of PPE, disinfection, prevention and mitigation, and even vending improvements in public facilities. There is a provision for captains in this section, but is very much related to the adaptation of public facilities, such as hospitals or health clinics, directly having a COVID nexus. Additionally, COVID-19 treatment and medical services includes expenses to enhance healthcare capacity, treat and provide care and services for near and long-term medical needs for patients, genomic surveillance, treatment expenses, including post-intensive care syndrome. Enhancing behavioral mental health. This is an area that people have been looking at for investments with this funding. As we've all sort of found out, the behavioral mental health fallout from the pandemic in many ways have been as terrible as the pandemic itself. Suicide rates and substance abuse rates and others have skyrocketed. So there is funding to treat mental health, substance misuse, hotlines, crisis intervention, overdose prevention, infectious disease prevention, and behavioral physical health, primary care services. Ongoing, again, I told you there was a lot packed into this category. Support local health and safety workforce, including payroll and covered benefits for county and municipal workers who primarily or partially work regularly to mitigate or respond to COVID-19. Similar to CARES Act CRF, this is public health, public safety, healthcare, human services, and other employees. Again, like the CARES Act, there is a presumption of allowability for public health and public safety. But generally speaking, Treasury is looking at a 51% of their time sort of standard for covering the entire salary, or you can partition out pieces of individual salaries. Improving design and execution of health and public health programs, including efforts to improve programs addressing the COVID-19 public health emergency, targeted consumer outreach, improvements to data or technology infrastructure, impact evaluation and data analysis, and finally, addressing disparities in public health outcomes. So recognizing the disproportionate impact of COVID-19 pandemic on health outcomes in low income and rural, and the importance of mitigating these effects, the interim final rule identifies a broader range of services and programs that will be presumed to be responding to the public health emergency when provided in these communities. So generally speaking, you need to have a direct nexus to COVID-19, but there's also this opportunity to branch out a little bit further in these targeted communities that might have less of a direct nexus to the pandemic, and more of a sort of a longer lasting outcome, food scarcity, access to primary health, those sort of activities. So that's just the public health side of this. The negative economic impacts, funds may be used to respond to the public health emergency or its negative economic impacts, including direct assistance to households, small businesses, nonprofits, and aid to impacted industries such as tourism, travel, and hospitality. Tourism, travel, and hospitality are called out specifically, but there is flexibility and discretion to identify other impacted industries. You would just need to document your justification as to why you're targeting those other industries. Assistance to households may include things like assistance, rent, mortgage, utilities, counseling, legal aid, direct cabins, emergency assistance with burials, home repairs, weatherization, internet access, job training, etc. Treasury does want you to provide a justification, so you can't just say every resident in our community is getting a check for $5,000. There has to be a rationale for the widespread distribution of assistance and the amount of resources being distributed, keeping in mind sort of this universal concept of reasonable and appropriate. So Treasury doesn't set specific limits, but they are looking for you to have a rationale and a justification, not just cutting checks for households in your community. Small business and nonprofit support aimed at adopting safe operating procedures, weathering periods of closure, or what we would be doing a lot of now is mitigating past financial hardships resulting from the pandemic. This can be in the form of loans or grants, such as declines in revenue, impacts of business closure, payroll, benefit costs, cost to retain employees, mortgage, rent, utilities, and other operating costs. You can also support these organizations on a go forward sort of mitigating perspective, investing in things as physical plant changes to enable social distancing, enhanced cleaning efforts, barriers, partitions, COVID vaccines, COVID vaccination, testing, or contact tracing programs. So programs like outdoor dining programs might be an example of a type of program you would do to support the restaurant industry to help them with COVID prevention or mitigation tactics. Also, just general technical assistance around business planning would also be an allowable use. According to the rule, additional criteria may be considered to target assistance to businesses in need, including small businesses. This may include businesses facing financial insecurity, substantial declines in gross revenues, other economic harm due to the pandemic, as well as businesses with less capacity to weather financial hardships, such as small businesses that were left with less access to credit, or those serving disadvantaged communities. Recipients really should consider local economic conditions and business data when establishing criteria for these programs. So I know that was a lot for one slide, but I really felt it was important to kind of highlight how much programmatic opportunity and flexibility there exists just in that one category of responding to public health emergency and negative economic impacts. Document your methodology, document the rationale for the program, make sure your program meets kind of a reasonable and appropriate standard, and then there's a lot of opportunity there to move forward. Couple other things, you know, again, we talked about aid to impacted industries, rehiring of local government staff, and assistance to unemployed workers. Um, and what's kind of new to the ARPA funds and the state and local fiscal recovery is Treasury really wants to measure the outcomes and success. So they're also allowing the use of funding to improve the efficiency of these economic relief programs. So you can use funding not only for the programmatic purposes, but also for data analysis, targeted consumer outreach, improvements to data or technology infrastructure, and impact evaluations. This is good from a programmatic perspective in general, but as you know, we also have some new reporting requirements with this funding. So having that data will be valuable for that as well. Next slide. So additionally, this is one of those other swim lanes I talked about earlier. So additionally, Treasury will presume that certain types of services are eligible uses when provided in a qualified census tract to families and populations living in a qualified census tract, or other households, businesses, or populations disproportionately impacted by the COVID-19 public health emergency. So a qualified census tract, or QCT, are those in which 50% or more of the households are income eligible, and the population of all census tracts that satisfy this criteria does not exceed 20% of the total population of the respective area. On the slide, you'll see a link to Housing and Urban Development, who have a mapping tool where you can look at the qualified census tracts within your community. You are not limited to just QCTs. You can also create your own definition for businesses, households, businesses, or populations disproportionately impacted by COVID. This might be, a rural population dealing with lack of access to, fresh food, primary health. It might be a community that has had limited access to, clean drinking water, or dealing historically with health conditions from a Superfund site or brownfield. So this is really an opportunity to address some of these historic and disproportionately impacted communities, and resolve some of those issues. Within these QCTs or equivalent, you can provide services such as community health workers who will help residents access health services and resources, public benefit navigators, and housing services. So you will not see housing elsewhere in the interim final rule except for here when addressing QCTs and equivalent, or in revenue replacement, the provision of government services. So there's a lot of interest around housing, and this is one of those areas where housing services that support healthy living environments and neighborhoods that are conducive to mental and physical wellness. In the infrastructure section, you'll see language around water and sewer projects, but within this section, lead remediation, whether that be lead drinking lines, lead paint, asbestos, those sort of projects could be funded. Evidence-based community violence intervention programs that will prevent violence and mitigate the increase of violence during the pandemic. Again, programs addressing housing insecurity, lack of affordable housing or homelessness. Impacts on education, including need for expanded learning service, assistance to high poverty school districts. Childhood health or welfare, including childcare, home visits by health professionals, parent educators, social service professionals, etc. So the takeaway from this slide is that if you're addressing a qualified census tract or equivalent community, the nexus to COVID is not as important as allowability consideration. So there's a presumption of allowable activities when you're targeting one of these communities. Next slide. So premium pay, there's been a lot of interest in this. The ARPA funding may be used by recipients to provide premium pay to eligible workers performing essential work during the COVID-19 public health emergency, or to provide grants to third-party employers to compensate those eligible workers who perform essential work. Defining the concept of premium pay in essential workers, Treasury states that to ensure that premium pay is targeted to workers that faced or face heightened risk due to the character of their work, the interim final rule defines essential work as working involving regular in-person interactions or regular physical handling of items that were also handled by others. So this is not just a cash bonus program or a recruitment retention program. It's really intended for those who were doing in-person work. So an individual who teleworked or worked remotely may not receive premium pay under this program. The premium pay may be provided retroactively for work performed at any time since the start of the COVID-19 public health emergency. So not retroactively back to March 3rd of 2021, which is the covered period for this funding, but actually all the way back to January 27th, 2020, when the pandemic started, for those workers that have yet to be compensated adequately for the work they previously performed. Some examples of workers that are eligible for premium pay include work performed by an employee of state, local, tribal government, staff at nursing homes, hospitals, home care settings, farm workers, food production facilities, grocery stores, restaurants, janitors and sanitation workers, truck drivers, transit staff, warehouse workers, and the list goes on. Treasury is not trying to provide an exhaustive list, but they do provide a pretty broad list of eligible professions, but you still have the flexibility to create your own criteria and define categories of workers that would fall into that. I just happened to see the question about election board workers. Yes, election workers who were providing in-person services at poll locations certainly would meet this criteria as well. Premium pay definition. Premium pay means an amount up to $13 per hour in addition to wages that the worker otherwise receives. The aggregate amount cannot receive $25,000 total per worker over the life of this program. So there's a $13 per hour cap and then a $25,000 cap over the life of the program. Treasury does urges recipients to prioritize premium pay for low and moderate income persons, but this does not mean that you're limited to that. If you intend to provide premium pay to workers in a higher income category, above 150% of the average annual wage for your community, it is allowable. You would just need to provide a justification of why it makes sense to target those individuals. There's a question about premium pay versus regular pay. So yes, if you were going to pay a public health or safety employee salary, you could pay that 100% with the funding, including benefits. But then you could also, if wanted to, incentivize above and beyond that with the up to $13 per hour. So the two are not mutually exclusive. You could do both within the program. Next slide. So revenue loss, we actually have 3 slides here. ARPA funding may be used for the provision of government services to the extent of the reduction in revenue experienced due to the COVID-19 public health emergency. This means that the amount determined as lost revenue may be used for most regular government purposes, except for activities such as rainy day funds or reserve funds and debt service payments. The interim final rule implements these provisions by establishing a definition of general revenue for purposes of calculating a loss in revenue and by providing a methodology for calculating revenue loss due to the COVID-19 public health emergency. Generally speaking, Treasury has given a lot of flexibility, a lot of opportunity for jurisdictions to determine revenue loss. Once you determine revenue loss, the provision of government services opens up a lot of allowable categories for jurisdictions to fund projects. There has been confusion about this program around things like road infrastructure. Really, the only way you'd be able to fund road infrastructure would be after the calculation of revenue loss and the provision of government services. There have been some other questions about, supporting, judicial branch and some things like that. So really, once you calculate revenue loss, you know what that number is, and you're going down the road of provision of government services. That really opens up the most flexibility, the most allowability for your community. Treasury is allowing revenue loss to be calculated at 4 different periods in time: December 31st of 2020, 21, 22, and 23. The expectation is the calculation you do for December 31st of 2020 will likely realize the greatest amount, but that might not always be true for every community, so they are giving you this flexibility to calculate at several different periods in time. The definition of general revenue is based on the US Census Bureau's definition and includes revenue from taxes, current charges, miscellaneous general revenue, and intergovernmental transfers between state and local government. The definition excludes federal intergovernmental transfers to counties, including CARES Act funding, and excludes other correction transactions, proceeds from issuance of debt, sale of investments, agency or private trust transactions, and revenue generated by utilities, intergovernmental transfers from the federal government, federal transfers made to a state or locality. The Census Bureau's process definitions is to be used as sort of a guidance tool. It is not an absolute. Jurisdictions still have a lot of flexibility to include certain revenue streams, exclude revenue streams. It really gets down to what your local standards are. I know there was a question about including interest. The answer would really come down to how you categorize interest charges locally. If they're categorized as general revenue, then you would likely include it. If you calculate or if you report it as other, then you'd likely exclude it. But you have a lot of flexibility and do not have to follow the census process directly. The definition of government services includes, but not limited, maintenance or PAYGO funded building of infrastructure, including roads, cybersecurity, hardware, software, protection of critical infrastructure, health services, environmental remediation, schools, provision of police, fire, and other public safety services. So I know a lot of jurisdictions have things like old computer systems, servers, mainframes, those sort of things. Really, the only way you'd be able to consider those an allowable use would be through this definition of government services under the revenue replacement category. Next slide. So just wanted to give kind of a sample calculation, what it would look like. So the base year revenue is the revenue prior to the pandemic, prior to January 27th of 2020. For most of you, it would be your fiscal year 19. It might be another year for some of you. The growth rate, Treasury allows you to either use 4.1% or the average of the 3 prior years to the base year, whichever is greater. If for 16, 17, and 18, you had an average growth rate of 6% or 7%, you are able to use that instead of the 4.1%. If your growth rate was less, average growth rate was less than the 4.1%, you can use the Treasury 4.1%, whatever is most beneficial to your community. And then we tried to give you an illustration of how the calculations might change over time as you have months elapse from the base year. So didn't want to dive too deep into this slide, but it's pretty straightforward, the calculation. A lot of people, I think, are overthinking it. So we just wanted to show you at a very high level what it would look like. And on the next slide, there's actually a couple revenue loss calculators out there. Certainly Treasury in its FAQ has an FAQ that has the exact calculation, but the National League of Cities and now the National Association of Counties have both put out revenue loss calculators on their website, which are a pretty easy tool to use to help you work through your numbers. Next slide. So investments in infrastructure, a lot of interest here. The interim final rule outlines eligible uses within each infrastructure category, allowing for a broad range of necessary investments in projects that improve access to clean drinking water, improve wastewater and stormwater infrastructure systems. The interim final rule does this by aligning eligible uses of the ARPA with the wide range of types or categories of projects that would be eligible through the Environmental Protection Agency's Clean Water State Revolving Fund and Drinking Water State Revolving Fund. I want to note that these programs are provided as illustrative in nature, and there's no specific approvals or submissions to the actual state program. So an allowable use doesn't have to be included in the Kansas program. You don't need to go to the Kansas state agencies to have your projects approved. I would really refer you back to the Environmental Protection Agency's website, where they have information about these programs, just to see kind of the exhaustive list of allowable activities that you can do under these programs. So additionally, the rule provides state, local, and tribal governments with wide latitude to identify investments in water, sewer infrastructure that are the highest priority to your communities. This could include projects on privately owned land or privately owned infrastructure. And then again, woven throughout the interim final rule is this emphasis on lead abatement. So Treasury encourages recipients to consider projects to replace lead service lines. One other note about kind of these infrastructure investments. These are projects that are really easy to get going and off the ground. And because you would not have a lot of subrecipients or beneficiaries, they would also keep your audit compliance and reporting responsibilities fairly limited as well. So definitely an area to consider for you going forward. Clean water projects provide financial assistance for a wide range of water infrastructure projects to improve water quality, address water pollution, types of projects, construct and improve and repair wastewater treatment plants, control non-point solutions, sources of pollution, improve resilience of infrastructure to severe weather events, create green infrastructure, and protect water bodies from pollution. Drinking water projects assist communities in making water infrastructure capital improvements, including the installation and replacement of failing treatment and distribution systems. In administering these programs, municipalities must give priority to projects that ensure compliance with applicable health and environmental safety requirements, address the most serious risks to human health, and assist systems most in need on a per household basis according to state affordability criteria. These are concepts that are already built into your community's capital improvement plans or long-term plans. So pretty easy criteria to meet. Other eligible uses include projects related to stormwater runoff, water pollution, flood control, and green infrastructure that supports stormwater resiliency, including rain gardens and green streets. The other major infrastructure provision is broadband projects. Broadband should provide universally available, high-speed, reliable, and affordable broadband coverage. Eligible projects include investments to unserved or underserved households with speeds below 25 Mbps download and 3 Mbps upload, and meet or exceed symmetrical upload and download speeds of 100 Mbps. The broadband projects are really intended to be, middle mile, last mile, bringing service to homes and businesses, and be able to measure improvements of speed and connectivity. Treasury used the FCC's broadband speed guide to determine the appropriate speed requirements for eligible projects. These speeds are not absolutes, and in many communities, any broadband connectivity is better than what they have now. So I would not allow, don't let these specific speed requirements convince you to not do investments in these projects. A justification or rationale can be made why a community may or may not meet these speeds, but would still benefit greatly from a broadband project. Next slide. So the rule indicates that there are two explicit ineligible uses. As it pertains to states and territories, funds may not be used for directly or indirectly offsetting a reduction in tax revenue. As it pertains to everybody else, funds may not use for depositing funds into any pension fund. Through the FAQs and additional guidance, additional ineligible expenses include expenses related to issuing tax anticipation notes that are not an eligible expense in our ARPA. Lost revenue recoupment may not be used for rainy day or reserve funds or debt service. ARPA funds may not be used as non-federal match for other federal programs. This is a significant change from the CARES Act CRF, which allowed funding to be used as a match for Stafford Act. Funds cannot be used to cover premium pay for workers who engaged in telework. And then general economic development and infrastructure projects, such as road construction, bridge repair, that are unrelated to COVID-19, except, as we've discussed, funded through lost revenue replacement or in one of these qualified census tracts or disproportionately impacted communities. Next slide. So as we move from the allowability, wanted to touch just really quickly about sort of oversight and compliance requirements. Again, we will do deeper dives over the coming weeks into these, but just wanted to highlight, a couple distinctions between the CRF money and now the ARPA funding. Again, for many of you, you had a pass-through relationship from the state. So that's a key difference. But also Treasury waived or excluded many of the federal compliance requirements with CRF, and they have not done that with the state and local fiscal recovery funds. So just to highlight a couple of them, the first one being sam.gov. For those of you that funded small business programs, restaurant programs, economic development programs with CRF, your subrecipients did not have to have a DUNS number, did not have to register in sam.gov. You did not have to check sam.gov to see if they were suspended or debarred from receiving federal funding. Unfortunately, with this funding, you will have to do that. So you'll have to build that process into your timelines and also into your internal controls. Again, things like reporting subaward and executive compensation, or waiting on additional reporting guidance from the Treasury Office and Inspector General. But they have cited 2 CFR Part 170, which calls for it. I touched on debarment and suspension. And then cost principles. For the most part, they were excluded with CRF. For the most part, they are included within the state and local fiscal recovery. You'll hear a lot of discussion about reasonable and appropriate, consistent application, that sort of thing. That's all language straight out of 2 CFR Part 200. Next slide. So some other specific Treasury requirements that are not part of the federal uniform guidance. Record retention, you will have those requirements. Generally, it's 5 years. Administrative costs were allowable under the CRF. They are still allowable under the state and local fiscal recovery. What's new is you can also do indirect cost recovery, which is a pretty significant change. And if you review your grant agreement, you'll actually see that reference in your grant agreement to indirect costs. For those of you that have a negotiated rate, you'll be able to apply that. For those that might not have a negotiated rate, you'll be able to use a 10% de minimis or provisional rate right away. So it's definitely something your accounting and finance people should look into. Recouping indirect costs does not increase your award. It does not make for more money, but it does give you the opportunity to pay for some back office items, which you might not normally be able to pay for with these programmatic dollars. Drug-free workplace, lobbying restrictions, seatbelts, texting while driving. For those of you that manage other federal grants, these are all pretty familiar. For those of you that are new to managing federal grants, not a real heavy lift here, just something you'll need to build into your documentation and internal controls. And again, we'll have additional webinars where we do deeper dives into these items. Next slide. So we've shared this slide before. Just want to go through it again. Review the Treasury guidance as we talked about in the timeline slide. It's changing, if not on a daily basis, on a weekly basis. If you have not already done so, once you're ready, submit your funding request. For those of you that are responsible for interpreting guidance for your local communities or making allowability determinations, I would encourage you to download the interim final rule in Adobe or a similar computer system that allows you to do keyword searches. It's really the easiest and quickest way to navigate the 151-page document. So if somebody asks you a question about infrastructure, you can quickly do a keyword search and find the applicable sections of the guidance. So doing that and relying on the FAQs are really your best bets at this point. Calculate the revenue loss. Again, I encourage you to use the National League of Cities or NACO tools that are out there. Conduct your community needs assessments. And then, hopefully the last couple slides highlights the importance of identifying or establishing your organizational structure. So for many of you, since you won't have a pass-through relationship from the state, and you are now direct recipients, all of those uniform guidance, internal controls, and other Treasury oversight, compliance, and requirement and reporting responsibilities are yours, and you'll need to establish that internal process and staffing model to manage that. Finally, continue to engage with the Recovery Office. I want to thank you all again for your time today for this webinar. There will be additional webinars where we go into specific sections of uniform guidance and some of the allowability categories in a deeper dive. Look for the Office of Recovery newsletter, sign up if you haven't signed up, and use the inquiry form. We've seen a lot of great questions and a lot of good conversations happening between local communities and state agencies with the Recovery Office using inquiry form. So definitely encourage you to continue that process. And with that, I will try and take a couple questions here in the last 10 minutes or so. So Micah, if you can help me out, if not, I'll just go through the chat a little bit. The first question I see is about including interest. It really as I talked about previously, it boils down to how you categorize interest. If you categorize it as general revenue or as other, you really have the opportunity to include it or exclude it, depending on what your local community wants to accomplish with revenue replacement. You have that flexibility there. There's a question. So every city employee worked through the pandemic, no days off or given outside of medical guidance. Would an across the board bonus to all employees that work through the pandemic be applicable? Certainly, that would be, not bonus, but provision of premium pay. I would just highlight the piece about in person. Assuming that these city employees were performing their work in person, be an eligible use of the premium pay provision. Election board workers, we addressed that. Certainly that would be an appropriate use of premium pay. Describing premium pay funding in addition to regular pay. Again, they're not mutually exclusive. You could use these funds for public health, safety, other individuals' regular salary in addition to providing them premium pay above and beyond up to the $13. If an entity, county, or NEU historically maintains a revenue neutral budget as a matter of policy, is it possible to demonstrate a loss in this category? And I think that's where you would look at using the 4.1% revenue rate provided to you by Treasury. So there is a potential to still demonstrate revenue loss for that category. Happy to dig a little deeper into this question, and if you want to send it also in through the inquiry form, but my initial answer is yes, by applying the 4.1% rate provided by Treasury. Courtroom expansion for social distancing, yes. I actually believe that's one of the specific examples provided in the interim final rule about the use of these funds. So that would be an allowable activity. Can investment in our wastewater infrastructure include the engineering and design cost of a plant expansion? Yeah, the funding is not limited to just the physical or capital or actual construction costs, but the total cost of the project. So engineering and design costs could be included. For a project to expand our public health building to provide more storage and office space for additional staff, would we need to show lost county revenue to fund such a project, or would be considered an expansion of health services? I think you could go in either direction. Certainly, it would be cleaner and simpler as a provision of government services under the revenue replacement category. But if you could also fund it through the COVID nexus, so needing storage for PPE, sanitation equipment, moving things out of the general workspace so that desk and workspaces can be moved further apart. There is an opportunity there to fund this project without revenue replacement and the provision of government services. The same question applies to replacing an ambulance that is funded by the county government. So this is an interesting one. You could potentially look at it from a couple different perspectives. The one is if you have call for service data that shows an increase directly related to the COVID pandemic that requires an ambulance be added or replaced. You could go down that road. If the ambulance that's being replaced is going to primarily serve a qualifying census tract or a disproportionately impacted community, you could go down that road. But certainly the cleanest way would be revenue replacement, provision of government services. But I do think you could look at, wear and tear on the ambulance because of the pandemic, because of the corresponding mental health issues. But you would really want to have call for service data and kind of year over year comparisons to justify that investment outside of the provision of government services. Have they determined if these funds can be placed in an interest-bearing account, or are they being treated the same as CRF? They can be placed in an interest-bearing account. There's a specific FAQ that they just added that talks to that. So you can accrue interest. It's a little vague about what you can do with the interest, but the general thinking is that the interest does not have to be used for state and local fiscal recovery fund purposes, but can be used for the general provision of government services. What is the deadline for determining the use of funds based on needs assessment, upcoming deadlines for reports? Again, you're a direct recipient from Treasury, I'm assuming. There is no specific deadline for county and local agencies for needs assessments. You have until December 31st of 2024 to obligate. So that would kind of be your ultimate deadline. And then we have some information on the Office Recovery website about deadlines for reports. I would also refer you directly to the Treasury. There are some differences on reporting depending on what type of jurisdiction you are, and if you're over 250,000 in population or not. Question asking for our NEUs, where do they submit required documentation to receive funds? Is there a portal? Send it to the Office of Recovery. There will be a portal. We're hoping the portal will go live in the next couple of days, but the NEUs will receive a communication when the portal is open and available for them to submit. Are there any deadlines for submitting a funding request? I'm not sure if that's coming from a state agency or local government. For state agencies, that'll be defined by the Recovery Office and the Spark Committee. For local governments, if you're a direct recipient from Treasury, there is no specific deadline. You have up until December 31st of 2024. If you're a non-entitlement unit of government, there will be a deadline which will be provided to you by the Office of Recovery, and it'll be in that same communication with the portal announcement.
Hey, Matt, I'm just going to jump in here for a second if I could.
Yep.
So Alicia Johnson-Turner, Deputy Executive Director with the Office of Recovery. I want to be clear, Matt has been answering a lot of very specific questions about whether things are allowable or not. This round, things are a little bit different because the flow of funds, even for non-entitlement units, that relationship is really between Treasury and your unit of government. So unlike previous rounds where the state was really making that determination of eligibility, that it would not be the case this time. So, you're giving Matt a very small amount of information to say yes or no to. I would encourage everyone to, work through your normal channels of determining eligibility. The state will be standing up a master services agreement that local units of government can draw down on to, help with things like eligibility. But I wouldn't make any major decisions based on this webinar and one conversation, because there could be a lot of nuances to that question that could change whether or not it is allowable. So I would encourage everyone to take this, sort of as broad guidance, but on your specific project, nail that down with your team or, a consultant of some sort. We will do our best to provide that broad guidance and, share that information as we can. Most of the time, if you email us, you're going to get a likely yes or a likely no. But it's very hard for us to make that determination. And we don't want you to be on the hook with Treasury if we say probably and you take that as gospel. So I would just encourage everybody to think about that as we close this out. Matt, were there anything else?
No, and thank you for that. I'm trying to be as helpful as possible. Hopefully, what I mentioned earlier in the presentation about now that you are direct recipients, you will need to decide who ultimately determines allowable uses. So internal legal counsel, finance staff, audit firms, consulting support. We will do our best, as Alyssa just mentioned, to try and point you to interim final rule, point you to FAQs, give you a likely yes, likely no. But there are nuances like, do you have the legal authority to do that project, or are you actually using it to match a federal source that we don't know of? And we will never be able to have that level of detail. So thank you, Alyssa, for that reminder and clarification. And with that, I'm not seeing any other questions, and I just want to thank everybody again for your time and look forward to ongoing engagement.
Thanks, everybody.